Okay, welcome everybody. Sorry for the late posted lectures or posting the lectures late. I unfortunately got well, turns out I have a rare variant of strep throat, which is why the doctors couldn't figure out what it was. But I'm now on antibiotics, so things are looking better now, and it doesn't hurt to speak, which I'm not gonna lie is a very unfortunate ailment to have if you want to lecture, but we're here now, so let's talk about some animal research ethics. Um, Now, in general, people in the past have thought that it is completely permissible to do medical research on animals. I think that the vast majority of people would say that it is at least fine in some situations to do medical research on animals. I would personally say that I think it's fine in some situations to do medical research on animals. Now, it's important to note that medical research on animals, right, they do oftentimes put animals in uncomfortable situations. You'll see videos which are kind of like released um by labs and stuff like that talking about how they treat their animals. And it's very true that animal welfare activists have made it so that animals who are being tested on, animals who are research subjects, are treated substantially better than how they used to be treated, like substantially better. While that is true, it's also true that these tests oftentimes necessarily put animals in positions uh, which are kind of bad or compromised or something like that. So, for example, I posted some information about this one specific practice, which is actually used for, um, originally was used for antidepressants or tests for antidepressants, and now it's used for medication for post-traumatic stress disorder. But there's it's called like the mice swim test. The mice swim study, something like that. Essentially, what researchers sometimes have to do is they need to induce stress on mice and then see how the medication affects their stress levels. So, in order to induce the stress on mice, what they do is they put the mice in a tank. The tank is just filled with water, and then they pretty much force the mouse to just swim around in circles. If it stops swimming, then it's going to drown. It's not going to let itself drown, so it just swims and swims and swims for a very long time, right? Um, I think if people did this to humans, uh, completely unnecessarily, I think people would say like this is like torture. This is like the equivalent of torture, or it's maybe a low form of torture or something like that. I don't even think it's a low form of torture. I think that's like terrible. Um, but most people will think that this is fine to do on animals, and there's definitely the question of, well, are they wrong? Is it fine to do on animals? Um, but there's also the question of, well, why do people think that? Um, and in general, right, traditionally, ethicists have made a variety of different points to argue that it is permissible to use animals as research subjects in experiments like these, right? So one common argument which they would make is they would say something like animals have no moral standing. Or we could say animals are not moral patients. Okay. So quick terminology, so quick explanation of terminology here. So a moral patient is someone who is or something that deserves some amount of ethical respect. So For example, we think that other people are moral patients. They deserve some amount of ethical respect. We think that, or most people think that dogs, to some extent, are moral patients. Maybe not to the level that humans are, but they deserve some level of ethical respect. You can't just like kick a dog unnecessarily. Rocks, on the other hand, right? Rocks aren't moral patients. Like you can take a hammer and fucking smash that rock. No one gives a shit, right? That's fine. Rocks are not moral patients. Um, no, this should be contrasted with another term, which is moral agent. I'm not sure if I'm going to have to talk about moral agent specifically in this lecture, but it's good to know these terms, and these are related terms, so I'll define both of them. Um, a moral agent is someone who can do an ethically or something, I guess, that can do an action that is ethically blameworthy or praiseworthy. Or we could just say that is ethically analyzable or criticizable. That's better. Okay, how do you spell criticizable? That's not how you spell criticizable. You know, doesn't really matter. So we're just gonna go with that. Um, So a moral agent is something that can do an action that is ethically criticizable. So what I mean by this is you could take a look at something that they've done and be like, man, they shouldn't have done that, or man, that was a good thing that they did that. Um, we usually think of humans or adult humans or at least semi-matured humans as being moral agents. We don't think of babies as being moral agents. Now, babies are moral patients, and humans are also moral patients, right? These are not mutually exclusive terms, right? Babies are moral patients. They deserve ethical respect. But it's not like a baby can really do something where you would see the baby do that and you're just like, you're a bad fucking person. Like that wouldn't really happen. Um, Most people think that like wild animals are not moral agents. They can definitely do things which seem to cause a lot of good or bad. Like a bear mauls an innocent hiker. Absolutely terrible. But we wouldn't say that it's a moral agent because it would be weird to be like, ah man, that bear shouldn't have done that. Okay. Just important terms to know. Okay, going back to animal research, right? So, people may say something like this, or people did traditionally in the past say something like this. They would say animals are not moral patients. Um, and because animals are not moral patients, well, we don't really have to think about how we should treat them ethically. So, yeah, of course, it's going to be ethically permissible to use them as research animals. Sort of a second approach, which is much more common now, is to say that animals are moral patients, but they're less deserving of respect than humans. Um, like you can't just like abuse an animal because of it, like it's a moral patient. But if you have to prioritize a human or an animal, all things considered, you should prioritize the human. Um, That seems to be like a pretty plausible principle, and this seems to be what the vast majority of medical researchers believe now. Um, Now, it's important to note that if you make some sort of claim like this, you say animals are not moral patients, but humans are, and animals are less important than humans, then you would need some sort of justification for these claims. Usually, what people do to justify these claims is they'll point to some sort of attribute that humans have that animals do not have. Some actual difference between humans and animals, or humans and non-human animals, but I'll just say humans and animals. Um, and then say, well, this actually has ethical importance. So, one obvious example that people will point to is intelligence, but we may also say, like, um, the ability to be in society or integration into society, right? I mean, animals, they have communities, but they don't have societies. Societies are restricted to humans. Or we could point, some other topic, but these seem to be kind of like the obvious ways that humans differ from animals. The issue with this is that for pretty much any sort of criteria where you say like, oh, well, look, this is why I think humans deserve more respect than animals. Um, People can come up with some sort of counterexample where they say, well, imagine there's a human, but the human doesn't have this. Does that human deserve moral respect? And most people say yes in these cases. So you say, okay, well then the difference between a human and a chimpanzee or a mouse, the ethical difference can't be dependent on intelligence then. Right? Let me give you an example. So if somebody says that humans um are have more ethical importance than mice because humans have some level of intelligence or have are much more intelligent than mice. Someone may say, okay, well, there are some humans who have severe cognitive disabilities who are significantly less intelligent than some other humans. Do these humans with the severe cognitive impairments, are they less ethically important than a human who does not have those? And obviously the answer is no. We don't want to say that. That would be an absolutely terrible thing to say. But if that's the case, well then it seems hard to justify um, the claim that mice are less important than humans because mice are less intelligent than humans. Same thing with integration into society or any other standard you can think of. Imagine some guy who just lives alone in the woods. Is he like substantially less ethically important than, most humans who live in societies? No, I mean, like, you can maybe argue that there's like less ethical importance, but like because he doesn't have a family or something like that. But like, that's kind of contingent and besides the point. It doesn't seem to really create like a very substantial, like core ethical difference. Um, and because of that, we would go ahead and disregard the kind of ethical standard which says that you need to be integrated into society in order to have like maximum ethical standing. Or in order to have like substantial ethical standing, we can say, or something like that. Pretty much any possible factor which you can think of, you can come up with some sort of counterexample like this. People have been doing this for years. By the way, this is very similar to the abortion debate. When you're talking about whether or not a fetus is a moral person, you're trying to say, okay, well, what would make a fetus, what qualities would a fetus have in order to have the same level of ethical consideration that we would give humans? In some way, right, we are just asking this very same question again. Now, there's sort of a third way to justify animal research, which I find much more compelling than either of these two. Um, and it's to say something like this. Instead of talking about like the fundamental uh moral importance of species, what we can talk about instead is the obligations we have to the species. And what we can say is we have less ethical obligations to animals than we do to humans. Now, why do we have less ethical obligations to animals than we do to humans? One, I think, plausible answer is just the fact that, like, we're very different from humans to, we're very different from animals. And if you think about it, like, in many ways, we sometimes will give sort of ethical priority in our own lives to people who are more similar to us. And this seems completely justified. So, if we're talking about like who you should think about first, or who you should give the most ethical importance to, right? Out of any sort of person, we may say that the most important people, right, are like your family. We'll just do F or FA. There you go. Good enough. And then the second most important class of people may be like your friends or people in your community, right? Ignore this, right? And then after that, we may say like your, I don't know, countrymen, maybe. If you're like a nationalist, you may say that. And then you have like humans and stuff like that. Um, and I mean, like this makes sense, right? Like, uh, if you were going to choose between saving your mom's life and the life of some random person on the street, or maybe two random people on the street, I think you would be well within your right to prioritize saving your mom. In fact, I think that maybe you actually ethically ought to save your mom in that situation instead of the two random people. Because you have a special obligation to your mom. Why do you have a special obligation to your mom? It could be because being in the same family creates this level of similarity, which has some level of ethical relevance. Um, you could say the same thing with people in your community, or people who are your countrymen, or people who, are fellow humans, and the people who are fellow mammals. But sort of the broader you get, the less obligations you would get to that group. So this would kind of explain why we think that humans have more ethical obligations to, let's say, chimpanzees who are very genetically similar to us than they do to fish or mice or something like that, right? Who are very genetically different from us. Um, Now, it's important to note that for this approach, right, you're saying is that we have less ethical obligations to animals than we do to humans. This doesn't imply that we have no ethical obligations to animals. Um, if we take this approach, we would still want to say something like this. Animals have ethical importance, and that should restrict what we are allowed to do with them. So then the question arises, which is, when is a study morally permissible and when is it not morally permissible? When is a medical study morally permissible? A medical study that uses animals morally permissible and when is it not morally permissible? I can cook up like obvious examples of medical studies that are not morally permissible. They use animals. So say I needed to test, the mouse stress that we were talking about earlier, you know. Uh, and in general, people will like put the mice in a bucket of water and they'll see it swim around and around and around. Imagine instead of doing that, like I started to like slowly stab the mouse. If that wasn't torture before, having the mice swim around and around, this is definitely torture. You're just like slowly stabbing the mouse. Definitely seems like torture. I think most people would say that that is completely unjustified. Um, and I think it clearly is completely unjustified, especially given the fact that we could have some alternative method which um, is far less painful to the mouse. Now, in general, right now, um, here, let me do this here, because this would apply to both of these arguments. Um, Ethicists have sort of like a variety of, or medical researchers have a variety of rules when it comes to testing on animals. And like the broad rules are going to be things like this. Um, right. So minimize the sample size, essentially minimize the amount of animals used. Wow, and right, I'm going to make sure I say all the caveats, which they don't always say in these videos, while making sure that it is large enough to give um, adequate evidence. So you can't, in science, have a sample size in a study of two. There's just too little people, right? Too few people, or too few subjects. If you have a sample size of two, there could 100% just be chance, and then you could get, findings which would not actually represent what we would imagine would happen if the medicine or practice or whatever was actually implemented to the general public. So we want to have big sample sizes. Um, so we're not going to give up the large sample sizes, but we're just not going to make them overly large when we're using animals because we don't want to cause any sort of unnecessary distress. A second common condition, which some people say, um, or like common rule, which people have, is something like this. Do not cause harm that is unnecessary to attaining the research goal. So earlier I gave the example of, imagine you're stabbing the mice. That would not be permissible because we could use a method which requires far less harm or causes far less distress than that method. Um, we could 100% do that. So it would be unnecessary to go all the way out. And the third, like, kind of common rule which people have is use, or if possible, use alternative methods to doing animal research. Now, notice that for all of these kind of rules that we see commonly, um, we're not really sacrificing much. What do I mean by this? Well, so for the first rule, we have this little clause where we say, okay, minimize the sample size, but make sure we get enough evidence. We cannot make it so that our evidence is worse for the sake of the animal. So we're prioritizing our study and our interests over the animal's interests. For the second one, we're not saying don't cause unnecessary harm. We're saying we're not saying don't cause harm to the animal. We're saying don't cause harm which is unnecessary for the research goal. And by doing that, we're presupposing that the research goal is more important than the animal's well-being. Um, and then the third one is saying, if possible, use alternative methods, but if not possible, use the animals, right? It seems like all three of these conditions presuppose that really no matter what the research goal is, it's still more important than the animal, or our goals are always going to be more important than animals. But if we believe that we have some ethical obligations to animals, this isn't necessarily going to be the case. We may want to actually change this. So instead of saying, like, do not cause harm that is unnecessary to attaining the research goal, we would say something like this, like, do not cause harm which would um, um, be greater than the good caused by the research. Something like that, adding a sort of proportionality requirement to it may be necessary. Um, Now, there are all sorts of different ways that people can do this, and there's a lot of different stuff that I could say. However, I think I'm just going to stop it here because this has already gone longer than I would like. All right. Thanks.